Welcome to Nursing Simplified, the smart way to survive nursing school. In today's episode, we are going to talk about the top 10 test-taking tricks that you can use to pass the NCLEX, or any exam for that matter, on your first try. Make sure you stick around until the end where I share my bonus tip. Okay, let's dive in. Tip number 1, identify the components of the questions. Now, I'm not going to get too in-depth here because I will have a whole video on this coming up soon. I'll link it in the description below as soon as it's released. But what you do need to know is that each question has different components. First, we have the item itself, and this is the whole question and the answer. The stem is the actual question. There is often a lot of extraneous information in a question that can throw you off. You need to ask yourself, what is the question actually asking before you move on? Options are simply the possible responses. And you're probably familiar with the term distractors. For now, just know that these are the incorrect answer. And then lastly, we have the correct answer. Now, always make sure you read the stem at least twice. It will increase your chance of success dramatically. Piece of cake so far, right? Let's move on. Tip number 2 is to identify keywords. If the question asks for an intervention, then make sure your answer contains an intervention. If it asks for a sign, choose an answer that has a sign. And if the question asks for a symptom, make sure you choose an answer that includes a symptom. Eliminate the answers right away that don't have anything to do with the keywords in the stem of the question. And if you have questions about what the difference between signs and symptoms are, check out our video all about subjective and objective assessments. I will link it in the description below. Tip number 3, identify repeated words. Pay close attention to words that are found in the question and then are repeated in one of the answers. For example, a question might ask you about hyperthermia in the stem, and then one of the answers states temperature of 103.2. Often questions with repeated words or synonyms, which are just words that mean the same thing, are nudging you toward the correct answer. Tip number 4, do not second guess yourself. Look, we've all done it. We go back and review our answers, second guess ourselves, and change our answer only to find out that our initial answer was the correct one. If you know you've fallen into this trap, hit that like button below. And remember, your first answer is usually the correct one if you have taken the time to reason through the question. So don't change your answer. Tip number 5, look for opposite answers. If 2 of the answers have opposites in them, one is usually the correct answer. So if a question were to ask about a side effect of a medication, and one answer includes the word hypertension and the other has hypotension, chances are that one of those answers is the correct one. Tip number 6, read the entire question and identify the parts. And this is just one more reminder of a mistake I see students make time and time again. They read the question quickly. Maybe they don't even read the whole question. And a word or a phrase sticks out to them, and they base their answer on that. Don't make this mistake. Follow the formula. Read the stem at least twice, know what the question is asking, and systematically choose your answer every time. Tip number 7, once you understand what the question is asking, try to predict the answer. And this is a continuation of the previous tip. If you don't know what the question is asking, then you cannot answer successfully. Read the stem of the question and try to answer the question without looking at any of the answer choices. Once you have thought of some possible answers, see if any of the answer choices match your prediction. If they do, then sure enough, that's the correct answer. Tip number 8, pay attention to grammar. Watch for grammatical inconsistencies. Subjects and verbs should agree. And if the question is an incomplete sentence, then the correct answer should complete the sentence in a grammatically correct way. You can eliminate the answers that don't. Tip number 9, avoid absolute keywords. Words like always, never, all, every, only, must, except, and none are all absolute keywords. By choosing an answer that contains one of these absolute keywords, you are essentially stating that something is always one way or another. But one thing we know about nursing is that things will surprise you at every turn. Nothing is set in stone, so avoid most answers with absolute keywords. Tip number 10, rephrase the question. If you find that you are having a hard time determining what the question is asking or what the stem is, try rephrasing the question by putting it into your own words. Then, read each answer choice separately and decide if they are true or false. This way, you can eliminate distractors like pieces of a puzzle and answer the question correctly. Sometimes this will help you pluck out the unnecessary information so you can focus on the stem. Okay, as promised, here's your bonus tip. Use prioritization techniques. This is another tip that has its own episode coming soon, but I can't tell you how many times this one saved me. Prioritization skills are particularly useful with questions that use words like initial, first, and best. Use your ABCs, Maslow, and nursing process to answer questions. And when all else fails, look at the answers and ask yourself, which one of these would kill my patient first? By doing this, you have effectively prioritized, and your answer will likely be correct. Okay, so now for a quick recap. Understand the components of the questions, identify keywords, identify repeated words, do not second guess yourself, look for opposite answers, read the entire question, understand what the question is asking, and try to predict the answer. Eliminate distractors, watch for grammatical clues, avoid absolute keywords, and use your prioritization skills. So that's it, guys. Today we talked about the top test taking tips that you can use to pass the NCLEX or any exam on your first try. And if no one has told you today, you are beautiful, you are needed, you are loved, you are strong, and most of all, dear friends, you are enough. So, if you enjoyed this video or you learned something, leave a like and subscribe because you don't want to miss what's coming up next. Now go out there and be the amazing nurse you were meant to be. And remember, nursing is a work of heart. See you in the next video. Bye-bye.